Hello again, I am Dr. Nicholas, and in the last video I was talking about tooth decay. In this video, I will talk a little bit about root canal treatment. Now, sometimes tooth decay does get into the root canal of your tooth. And the root canal is basically a space in the tooth that contains the nerves and blood vessels of the tooth. Typically, when you look at the tooth, you're only looking at the enamel, which is the white part of the top part of the tooth. But actually, the tooth has a root, and in the middle of the root, there is a nerve. Now, if tooth decay allows bacteria into that nerve, we have to clean it out. We have to now wash out that entire system and fill it up. And that's going to remove your dental pain while keeping your tooth. I do have patients who ask me about the safety of the procedure, whether it causes cancer, whether you die from a root canal, whether you will have multiple problems that have no explanation because of root canal treatment. And I think if you do a root canal very well and you can eradicate that infection properly, you catch a root canal early, I believe it's a very, very safe procedure, all while keeping your own natural tooth. And trust me, as a dentist of many, many years now, I've been practicing like 13 years now, thinking, wait, how long did 2013, I graduated 2013, now it's 2025, 12 years. So I've been practicing for 12 years. I feel that keeping your own natural tooth is one of the best options available. Root canal does not have a 100% success rate, but it has a very, very high success rate. And so, in my opinion, keeping your own tooth, there's just nothing like it. I think it's one of the best options around. Now, if you choose not to do a root canal, you can discuss that with your dentist and go for an extraction. But in general, most dentists that I know, most of my colleagues and friends, and myself as well, we recommend keeping your own tooth. And so root canal treatment is a good way because it removes the infection without actually removing the tooth. And that's the whole point of a root canal. Now, in this case, you would see from this x-ray that there is a white filling in the middle. And this tooth, the patient started to have a toothache because the bacteria is already now in the root canal portion of the tooth, unfortunately. And so the nerve is infected. It's a very painful experience. I hope none of you face it, but if you do, we do a root canal procedure, and that's going to solve your pain. Here we see that the tooth has been root canal treated. There are two white lines down the middle of the tooth, all the way down the root. And if you do that properly and you have a crown done on that tooth, I think you're going to keep that tooth for a good amount of time from for the foreseeable future if you take care of that tooth properly. So that's all for today's video. Thank you very much, and I'll see you again.